soon. So now I'm really excited to introduce Jocelyn Borras, who will be talking about something very unique that SCIU has, which is our nursing division. Welcome, Jocelyn.
Hey everyone, my name is Jocelyn Borras, and I'm your Nursing Division Executive Board Vice President of Long Term Care in Nursing Division. I'm happy to be here tonight to tell you more about your nursing division. Did you know that SEIU Healthcare is the only service union with a dedicated nursing division? We are proud to have this space for our diverse group of nurses across the province. The nursing division is led by our president, Jackie Walker, and we have a vice president for each sector and representative from all 8 regions. I got involved with our nursing division because I want to be the voice of the workers in our fight for our rights, especially to advocate for a better workplace environment and a healthcare system where our patient or resident health and safety are prioritized. Our nursing division keep our nurses updated on their unique professional standards, which are practice standards set by the College of Nurses of Ontario. We advocate for changes to the scope of practice in our profession to close the wage gap between the RPNs and RNs, for safety on the job, including proper PPE, to address the staff shortages impacting healthcare, for zero tolerance for violence and harassment of healthcare workers, and so much more. The pandemic has been incredibly challenging for nurses and all healthcare professionals. And so it is important that together we fight for what we need. We are asking our nurses to share your stories from the front lines of battling COVID 19. If you haven't yet, we would love for you to please upload a video directly on the scaunurses.ca/story site, as well for other healthcare workers to share story about nurses you know who go above and beyond. Telling our story is an important way to get the public's, our employer, and the government attention to create meaningful changes for our profession. We need to put pressure on those in power to do better for nurses and all healthcare workers. Our voices are incredibly powerful tools. SEIU Healthcare and CUPE's Ontario Council of Hospital Union recently surveyed nurses across the province. 93% of RPN reported experiencing mental and physical exertion. 66% of RPN reported witnessing a coworker experience violence at work, and 1 in 3 RPN reported not receiving paid time off when requiring to isolate due to COVID 19. Our President Charlene Stewards and our Nursing Division President Jackie, along with SEIU healthcare nurses, have been sharing this finding through media press conferences. We are letting the public know that what healthcare workers are experiencing is not okay. Enough is enough. We deserve better. The government must increase staffing level with full-time jobs that include benefits. We need access to mental health resources and safer working conditions. We have been urging the government to give healthcare workers their second dose of the COVID 19 vaccine sooner than 4th-month interval. Finally, after pressure from SEIU Healthcare, the government announced that they would reduce the wait time between doses for high-risk healthcare workers. and it's happening right now. On our seaunurses.ca website, you can find updates and many useful resources, including a recently published guide for redeployment of hospital workers to other hospitals to protect your professional standard of practice if you are redeployed. You can also find educational webinar. Our It's Time to Support RPN's campaign, a digital version of our nursing division magazine, Scrub and Scope, and so much more. One great thing you can take a look at is our Nurses Unite campaign, where we have received so many submissions from patients and clients across the province who are saying thank you to their healthcare professionals. Messages have come pouring in from the public to show appreciation to healthcare workers for your professionalism, compassion, and integrity. It will warm your heart to read these beautiful tributes. Thank you so much for this time.